Hi, everyone. We might just wait a moment for people to get logged in and then we will get started.
Did you hear when I was telling Victoria where I ended up being here today? So I'm at Wabash College because I had no internet anywhere. So I just came to a local college and asked them for a room in the library.
Interesting. All right. I think it looks like the number of people logging in is starting to slow down. Hello, everyone. Welcome back to our spring semester of seminars. It's my very great pleasure tonight to introduce Dr. Scott Bailey. Dr. Bailey is my new colleague here in reproductive medicine. Dr. Bailey's had a long career in reproductive medicine, both in academics at NC State and then more recently at Claiborne Farm in Kentucky, where he was most recently before joining us here in the fall. And tonight, Dr. Bailey is going to talk to us about treatment of infertility in mares and then some other announcements from our service. Thanks, Dr. Bailey.
All right, thank you very much for the introduction. I'll go ahead and share my screen and hopefully that will work. So, good evening. It's good to be in at least a virtual room with all of you out there. I hear that there were quite a few people registered, and I will do my best to answer any questions that you have as I go along. Obviously, I'm going to try and thread the line here. For some of you, this may be pretty basic information. For some of you, this may be the first time that you're really thinking about what it means to be breeding a horse and how to be successful at that. So as Dr. Donnelly said, my name is Dr. Bailey. I'm newly an associate professor in reproductive medicine at Cornell. And before I get started, I would like to make you all aware of the Symposium on Equine Reproduction, which is coming up the February 28th. So not this weekend, but next weekend. If you saw an old flyer, it said that registration would close on the 14th, but we've extended it at least through this, so that the people that are on this Zoom would know about it and also be able to attend. You can attend virtually or in person. There is a seating limit in person. We're not quite to the max, so there are a couple of spaces if you're in the Ithaca area that you could come in person. And if not, and you're interested in equine reproduction, I think this is a really nice overview. Each of us have chosen a topic that we care about passionately, and we would love to see you there. So tonight, the topic was medical management of mares. And I wanted to take a step back and just have a conversation about what it is really that is necessary for successful breeding in horses. And I think that the medical management is important, but the medical management that is in the literature and is exciting, where there are new developments coming out that people hear about, or new techniques that practices are starting to use, are not the most important thing for most owners. To have a successful season, I think the most basic thing is you have to define your goals for your mare, and you have to know where you're starting at with the mare so that you can make plans ahead of time. And then breeding management and optimization of reproductive health is going to layer on top of that. So it seems like the defining goals should be simple. Our aims are to have a mare be in heat and be inseminated, either live cover or via artificial insemination. And then the goal is that 11 months later, we'll have a foal. And that seems simple enough, but once you start to really dig into there are a lot of things to consider. For example, if you have a mare that's a performance animal, you have to calculate into your planning the potential that you might be losing that mare during breeding and pregnancy. So breeding may take 1 to 3 months, and during that time, she may be at a veterinarian's practice or going back and forth, and not able to fully participate in a training program or a competition program. And then during early pregnancy, especially in the South, it's recommended that she have light exercise as opposed to a high level of exercise. And then, especially in later pregnancy, she's naturally going to decrease her exercise. Of course, after she has a foal, then she will be out of performance for 18 months while she's nursing that animal and then, you know, recovering from the effects of pregnancy and or pregnancy and nursing. And so that's 18 months in total that she could be out of her performance career. Other things to consider are the availability of stallions. So if you're a thoroughbred owner and then the mare and the stallion physically have to be in the same breeding shed, and the stallion has to be physically capable of achieving penetration and ejaculating in the mare. And conversely, if we're not dealing with thoroughbreds, and then we might be interested in breeding to a stallion that's in a different state or a different country or that has been dead for any number of years. And so the availability and the fertility of the semen that we've chosen as a match to the mare is really important to know ahead of time. And then the desired foaling date is also a factor. There are certainly people that want a foal as early in the year as possible. The thoroughbreds are sort of the archetypal example of having a January 1 foaling date, but that's not the only breed that does it. And conversely, there are lots of people that would prefer to have foals after winter has stopped and there's grass and the environment is easier on a newborn. So if you have a performance horse that you're interested in breeding, and then you have to think about the cost for that. Obviously, if you want to continue to perform, maybe there's a cost of temporarily replacing her. Or maybe you just want to replace your performance horse for the future. And so one of the things that you're taking into consideration is that your valuable performance horse can be ultimately replaced by offspring from that. But there's also cost and risk associated with breeding itself. The course costs for veterinary procedures change over time and cost for stud fees change over time. But in the roughly 2010s, the average breeding cycle in thoroughbreds was about $600, and that's increased gradually. But in other breeds and other locations, the cost for breeding management may be higher than that, and $1,500 to $2,000 is not unheard of per cycle. And then the stud fee obviously ranges dramatically, with some studs being pretty reasonable in price and others being very expensive. When I went to Claiborne Farm, I had the privilege of working on Warfront, who at the time was the most expensive thoroughbred stallion on the market in the US, and his stud fee was $250,000. He's quite old, and it no longer is, and that's also no longer the highest stud fee that's required. But obviously, that's something that has to be taken into consideration. And then I put $1,700 in mare costs, $17,000 in mare costs on that. And that's a factor that we don't always take into consideration. So if a mare is out of performance for a year to 18 months, and then the board, food costs, and the depreciation associated with a horse just aging amounts to about $17,000 over that potential period of breeding. And then obviously there's costs associated with full care, training, medical bills, and both there's risk to the mare and risk that the foal would not make it into training and performance in the future. Ultimately, in the thoroughbred world, where this is pretty well documented and tracked, about 20% of thoroughbred mares are financially profitable. 80% either break even or don't end up making a profit with their breeding career. So defining your goals, whether it's financial or emotional, is a really important first step that I think is necessary and something that veterinarians and owners need to talk about. Obviously, those are primarily owner driven. And then the second thing is knowing where you're starting from. And that is something that a veterinarian most of the time is going to help with. And sometimes it's going to seem like the veterinarian is doing all sorts of different things and poking their heads and arms in places that you maybe weren't expecting. But the goal ultimately is to understand what the likely chance of pregnancy for that mare is, and what problems we might face. And so it starts with a physical evaluation. We want to know, does she have things like pelvic injuries? Is she in good systemic health? A mare that has Cushing's disease or equine metabolic syndrome might well not be as good a candidate to breed as a young, healthy mare that has no metabolic disease. Similarly, sometimes we decide to retire a performance horse and we're aiming to breed them because of one degree of lameness or another. And my experience is that lame horses are much harder to get pregnant than horses that aren't lame, and there are a number of reasons for that. The laminitic horse is a classic example, and as long as a mare has laminitis, it really shouldn't be a primary goal to think about breeding her. That condition needs to be resolved, and then the feet need time to stabilize before progressing. And then perineal conformation is, I think, often not taken into consideration. But perineal conformation varies from horse to horse pretty considerably. Thoroughbreds are notoriously have poor perineal conformation, in part because they're so fit and thin. But that can be true for many different breeds of horses. And perineal conformation is a primary driver of fertility. So after the general physical exam, the veterinarian should be doing a transrectal palpation of the reproductive tract. So here, palpating the cervix, feeling uterine bifurcation and tracking the uterus to make sure that it's symmetrical, palpating the ovaries, and then repeating that with a transrectal ultrasonography as well, looking for uterine pathology, cervical competence, evidence of urine pooling or pneumovagina, and then looking to confirm that the uterine findings and the ovarian findings match up. Because if they don't match, if there's asynchrony in the uterine ovarian findings, and then that's a pretty good indication that there's some sort of pathology that will have to be addressed. After the transrectal ultrasound exam, my next step is to do a vaginal speculum exam. And oftentimes I'll combine that with getting a culture and cytology, which will be the next thing. The vaginal speculum exam obviously doesn't give you much information of the uterus itself, but it can give you information about the competence of the cervix and the conformation of the vagina and the vestibulum, which are the outermost portions, essentially the barriers to infection that would protect the embryo and then growing foal. And then once we've looked at the outer portion of the reproductive tract, we'll extend our information into the uterus by obtaining uterine culture and cytology. Cultures can be obtained with a swab, as seen in the top little circle there, or they can be obtained with a small volume uterine lavage. In the end, what we're looking for is to be able to see the cells that are in the uterus and pair that with knowledge about what kind of bacteria are there. Now, the uterus isn't as we've learned in many different things. The uterus is not technically a sterile organ, but most culturable aerobic bacteria that we think of as causing disease shouldn't be in the uterus at any time of the cycle. And so knowing if there's either bacteria in the uterus or inflammation, this is an example of a uterus that's quite inflamed, would again give us information that would help us decide whether she's a good candidate to breed and potentially how. And then finally, the last and biggest step of the breeding soundness exam is the endometrial biopsy. The endometrial biopsy looks at very specific things, and it is associated with a close correlation with the potential fertility of the mare. So based on the breeding soundness exam, we should be able to give an owner, or you should be able to understand what the likelihood of successful breeding in the coming breeding season is. And we almost never say that a mare is infertile, but obviously if there's substantial pathology, there might be things that have to be addressed. And the breeding soundness exam also gives us potential treatment targets to either address a condition before or at the time of breeding. Now, ideally, we're going to address any underlying disease before breeding. And I'll just point out that the average mare has about a 65% chance of getting pregnant each time she's bred. And so, on average, most mares will fall in that 50 to 80% per cycle pregnancy rate. And that means that for many mares, they're going to have to go through at least 2 breeding seasons or breeding cycles, I apologize, in order to get pregnant. And that has to be taken into consideration. So, in order to have a successful breeding season, we need to know what our goals are. We should have a stallion selected both based on his potential value or the potential value of the offspring, but also based on the likelihood that the combination of that mare and that stallion will achieve pregnancy in that season. And then we need to understand where we're starting from. Now at Claiborne Farm, the idea was that the mares were going to get bred in the season regardless of outcome of a breeding soundness exam. And so we didn't do all of these steps because the farm knew that a certain percentage of mares would get pregnant regardless of what the breeding soundness exam looked like. And they were valuable enough that they were going to give those mares a chance. In contrast, if you have 1 or 2 mares and you're trying to decide which one to breed and you have a limited budget, and then it may very well be worthwhile to put some money into the diagnosis and do a breeding soundness exam at the onset of the season before you invest in multiple cycles of breeding on a mare that has a low chance of getting pregnant. So then breeding management is the next step. And this is where we synchronize the ovulation of the mare and the availability of the sperm, regardless what mechanism we're using for breeding management. I'm sorry, for actual breeding. And for this, we have to really follow the mare. It's not a process that we can take over and just direct. We have to follow the mare's physiology. And so understanding that physiology is both really important for veterinarians, but it's also really important as a horse owner. So mares are seasonal long day breeders. Naturally, they would cycle from mid-April to early October. And they have a period of transition where their ovaries are active, but they don't ovulate and can't get pregnant. That precedes that in the spring and then follows that in October. And most mares, 80% of mares, will have a period of just quiescence or winter anestrus, meaning that they're not cycling, follicles are not growing, they don't have any progesterone that would maintain a pregnancy unless they're already pregnant. If they're already pregnant, then they carry through that period of time. But if they were not already pregnant, and then there's a period of time in the winter when they could not be bred with just natural seasonal variation. The primary control of this is day length. It's not primarily temperature, although temperature variation does probably have some role, but pretty much it's day length. And so that's something that we will talk briefly about manipulating. And then once the mare is in her breeding season, and then she's going to have a regularly recurring cycle that's characterized by about a 2-week diestrus. That's the period when she thinks she might be pregnant, and so she's producing progesterone in basically preparation for an embryo, and then to give sustenance to an embryo during its early development. And then if there is no pregnancy during that time, she will return to heat or estrus, and she'll be in estrus or heat for 5 to 7 days. We monitor the mare's ovarian activity, and the primary thing that we're looking for in ovarian activity is follicular growth, which should happen at 3 to 5 millimeters a day. And then we're looking for the development of a large follicle that can be induced to ovulate, greater than 35 millimeters, or that would ovulate on its own, usually 45 to 55 millimeters in most of the breeds that we're working with. And then before the end of the behavior of heat, about 24 hours before, most mares will ovulate. And the oocyte that's ovulated will be available for fertilization for about 6 to 12 hours. So it's a pretty narrow window. And that pairs with the survival of sperm, which would be about 48 hours in the stallion if live cover is used, or about 12 hours after thawing if frozen semen is used. And so as we talk about breeding management and choosing a stallion, knowing where the semen is, how it will be delivered to the mare, and whether it can be done on a Sunday or a holiday is a really important part of a successful breeding season. So what does this physiology then look like clinically? So the first thing, many of you may already be pretty aware of what your mare acts like when she's in heat, but the first thing is to just watch the behavior. So mares that are in heat tend to be more willing to have a stallion or another horse approach them. Sometimes mares will have a favorite horse that they like and go and show heat to, but oftentimes they don't show really dramatic heat unless there's an intact stallion there. In the presence of an intact stallion, if they're in heat, they will approach that stallion. They proactively seek out stallions during heat and proactively avoid stallions when they're not in heat. They would allow the stallion to approach the hind end, oftentimes raise their tail, urinate, and then demonstrate their readiness for breeding by essentially standing for the stallion. Now, there are two things that have to happen in order for a mare to show heat. She has to have estrogen, which is produced in those follicles that we were talking about, and she cannot have progesterone. So progesterone is dominant, and we'll talk a little bit about that as we go along. So in order to know as a veterinarian what we're doing and where a horse is, we like to have that information about a mare's heat. My experience, having worked on a thoroughbred farm where mares are teased regularly, is that there is oftentimes confluence with my ultrasound exam and the mare's behavior. And when there isn't confluence, when the mare's behavior doesn't match my ultrasound exam, as often as not, that cycle is not going to flow smoothly. Doesn't mean that they can't get pregnant, doesn't mean that the oocyte is not good, but something is prohibiting normal crosstalk between the mare's behavior and the mare's ovary or uterus. And it is definitely worth taking an extra look when that's not happening. So I think that behavioral heat is a really important thing to look for if it's possible. Many times, though, you have a mare or two, and teasing a mare is not feasible or practical. And so you depend on a veterinarian to come and evaluate the mare. Most of the time, we're doing that with an ultrasound. And so we're looking at follicle size. Here you can see a fairly large round follicle. Here is a large follicle that's already starting to change shape. This follicle is ready to ovulate in the next 24 hours or so. And we compare that on the ovary to the presence of a corpus luteum. This is the structure that develops after ovulation when progesterone is needed. And this is the source of progesterone that maintains pregnancy for the early period of pregnancy. We combine the ultrasound of the ovaries with an ultrasound and palpation of the rest of the reproductive tract. So looking at the uterus, if the mare is in heat, has a large follicle, and doesn't have a corpus luteum that would make progesterone, and then she should have edema. And this structure right here is the whole uterus. And you can see that there are darker areas and lighter areas and darker areas and lighter areas. Sometimes that is very pronounced. And that's evidence that there's estrogen and not progesterone. At the same time, the cervix should soften and get wider. So we classify that based on how many fingers we can put on the cervix. And it's typically a 1, 2, or 3, or 1, 2, 3, or pregnant. These findings, edema and soft cervix in hopefully presence of a large follicle, are an indication that the mare is probably getting close to being ready to breed. In contrast, a mare that has progesterone in her system will have no edema and should have a tight cervix. So that would be an indication that either she's not ready to breed or potentially is early pregnant and we just don't know it yet. In the end, we're going to combine our examination, our knowledge of physiology and of the mare's behavior in order to synchronize our ability to get semen with her ovulation. And we do that mostly by following the mare. And the most important component of that really is knowing when the mare will be ready and having semen available at the time. But at the same time, we can manipulate things. We can bring them into their season by adding daylight to the end of the day. We can shorten the length of diestrus, or the period when they think they should be pregnant, by causing luteolysis, or elimination of the corpus luteum. That's done with a hormone called prostaglandin. And we can induce or synchronize ovulation with different hormones that imitate the hormones or replace the hormones that are produced in the brain and the ovaries that then lead to ovulation in the mare. The goal is to have an ovulation, have semen there at the time of ovulation or very close to it, because we know that this egg, the oocyte here, is only viable for about 6 to 12 hours. And ultimately, the two of those should combine to make an embryo. All right, so that is these steps that we've talked about really are the most important keys to successfully having a breeding season. Whether the outcome is what you want and you get a pregnancy, or whether it's difficult and it takes time. I think having set up your goals, knowing where you started from and what your chances were of success, and then optimizing your management, your following the mare, are the most important steps. Those are the things that will get you to the 65, 70, 75% pregnancy rate. Of course, as veterinarians, there are lots of things that we try to do to hedge our bets and improve our odds. And there are some mares that have problems that we talked about earlier that we really need to address those problems. And so there are a number of techniques that have been proposed that would optimize reproductive health and improve pregnancy outcomes. And we'll talk about those here a little bit. I would, though, just take a step back and reiterate, there is not a necessity for every mare that's being bred to get any of the therapies that I'm going to talk about. Timing, appropriate selection of semen, and timing of your mare and selection of the mare for the type of procedure that you're doing is by a long shot the most important part. And any of the therapies that we talk about from here on aren't going to substitute that. So this is highlighted by some work that I did while I was at Claiborne Farm, where we were looking at the necessity of therapies in maiden and foaling mares. And we decided that if they were on their first cycle of the season, they didn't have any evidence of inflammation, they didn't have any fluid in the uterus, and they ovulated within 12 to 24 hours after breeding, that we would divide them between mares that got treated and mares that didn't get treated. And you can see that the pregnancy rates in the untreated group versus the group that got antibiotics are pretty much the same. Interestingly, the pregnancy rates in the group of mares that was diagnosed with an infection was also pretty good in that group, but the loss rate between breeding and 45 days was much higher than it was in the group of mares that didn't have evidence of infection. So every mare doesn't need any procedure, not this procedure that I'm talking about next or any of the other ones. But some mares need one or all multiples of these. And the oldest procedure described is called the Kaslick's vulvoplasty. Basically, Dr. Kaslick's was a professor, a veterinarian who graduated from Cornell, and he happened to go to Claiborne Farm, where I worked recently. But separately from his location, he was breeding a large number of horses, and he observed that mares that had air in their vagina were less likely to get pregnant and more likely to lose the pregnancy. And so he proposed and studied that if that was the case and he closed the top, essentially did a prolonged episiotomy that you might hear about in human medicine, closed the top to prevent air from migrating forward into the vagina, that he found that he could get mares to become pregnant and stay pregnant. And in the veterinary industry, in many places, the Kaslick procedure is performed post-foaling, immediately 8 days after foaling. And in some cases, it's not performed post-foaling, but it's performed post-breeding. And in the case of live cover, it may be that it has to be performed both post-foaling and post-breeding 30 days later. What we know is that regardless of timing of this, the Kaslick's vulvoplasty remains, even almost 100 years later, the single most effective procedure to improve pregnancy outcomes in mares that have poor conformation. Other really common therapies that are used are antibiotics. It was shown in the mid-90s that adding an intrauterine infusion of antibiotics into mares at the time of breeding increased their pregnancies a little bit, by about 5%. And consequently, as we're trying to do everything that we can to get mares pregnant, it became fairly common for mares to receive an empiric dose of antibiotics after breeding, just to try and prevent contamination and secondary infections. I would argue that this is not the best use of antibiotics in veterinary medicine, or the most likely to result in us having antibiotics long-term, both for our veterinary patients and for ourselves. And so this empiric use of antibiotics may not be the best use, but in some mares that potentially already have infections, or that we know that they're at risk for infections, antibiotics do have a place in improving pregnancy outcomes. Similarly, the same groups of people that initially looked at antibiotics also looked at things that would help the uterus become cleared of dead sperm and other causes of inflammation and infection. And that's called ecbolic therapy, and essentially means therapy that promotes uterine contractions. Oxytocin or Pitocin in human medicine is the most common ecbolic therapy in both species. Other things that are available would be carbetocin and prostaglandin, also is a really potent ecbolic therapy. And it's widely used in both the US and Europe. And post-service treatment, so post-breeding treatment at 4 to 17 hours, had a similar effect to antibiotics and potentially an additive effect. So if you were to choose just one thing and then giving the mare something that would help clear out the dead sperm 4+ hours after breeding would be as effective as an antibiotic. In a mare that had problems, you might do both at the same time. And then the next more invasive step of procedure that could be done would be called a uterine lavage. That procedure essentially we're taking saline, even tap water, and infusing it into the uterus and then letting it drain back out, and infusing it into the uterus, fresh LRS, and letting it drain back out. And it's been shown that lavage is more effective than antibiotics at actually improving pregnancy rates. Now, that is also much more labor intensive, potentially significantly more costly. The difference in cost at Claiborne Farm was about $8 for a dose of antibiotics versus about $40 for a uterine lavage. That being said, if we know that it's more effective and if we have an indication to do it, and then this should be something that we have in our toolbox to promote pregnancy. So again, using the large number of horses that I had at my disposal, I started looking at what was the actual difference in pregnancy rate in different treatment protocols. And this was from just 1 year. I was looking at antibiotics alone, antibiotics with lavage, antibiotics with a particular variety of lavage that I had included vinegar in, and then a different antibiotic. And you can see that there's differences between the antibiotics in terms of relative fertility, but that in general, the lavage adds to the antibiotics as opposed to just resulting in the same pregnancy chances. Another approach would be to say, well, if the sperm and other things are causing inflammation and the inflammation potentially is causing harm, maybe we need to do something to diminish inflammation in those mares. And so there are anti-inflammatory treatments that includes things like Banamine or Bute, Equiox, Furacoxib are all non-steroidal antibiotics that can be used. And then steroids can also be used. Glucocorticoids like dexamethasone can be used. And then other things that alter the uterine immune response. And the two best studied ones are Mycobacterium or Propionibacterium cell wall extract. So that's Settle and Exstem. And both of those have been looked at in mares that have endometritis. And in both cases, there's been work that showed that in mares with endometritis or inflammation of the uterus, that these products given either directly into the uterus or as an intravenous injection can actually improve pregnancy rates. So we looked at that on a larger scale, not in mares that had been diagnosed with a problem, but just dividing our postpartum mares into two groups. And we were looking at what was the effect of these products in a large proportion of mares. And we didn't find on an individual cycle basis that we could show that those products improved pregnancy rate. But over the course of a season, it seemed that pregnancy rates were slightly higher in postpartum mares that received one of the Mycobacterium cell wall extracts compared to nothing. I think biologic therapies are the area of research that's gotten the most recent attention. Plasma has been around as an intrauterine infusion for a long time. PRP, or platelet-rich plasma, is used by performance horses to diminish inflammation and reduce layup time after injury. It's well known that the amnion, one of the fetal membranes, has good healing properties, and so for many years now, amnion has been harvested to help ulcers heal in the eye, and there are products available for that. And then IRAP is another biologic therapy that is similar to plasma and PRP in that it can be used for horses with orthopedic disease, but it also can be used potentially in the uterus. And these all have been shown to have both direct antimicrobial action and immune modulatory action in the uterus. They've resulted in higher pregnancy rates on full heat, higher seasonal conception rates in mares that receive both plasma and antibiotics, and decreased fluid, increased pregnancy rates in mares that had inflammation. So these products are fairly new. They have quite a bit of excitement around them, recognizing that we're talking about a 5% change in pregnancy rates, and these products all are fairly difficult to get. Many of them, you have to harvest the plasma from the mare, and then you have to process it to get platelet-rich plasma, and then you have to put it back in the mare with a certain number of hours, or have to purchase dehydrated amnion that has to be put in. These aren't inexpensive therapies, and so I don't think they're something to use routinely. However, if you know that they're available and have the potential to help in a mare that's having trouble getting pregnant, I think that's really valuable. And so we chose the amnion product to look at. We used a dehydrated amnion product in one group of mares and antibiotics in another group of barren mares, and we found that the dehydrated amnion product worked as well as antibiotics in that group of barren mares. And then in a group of 3 large practices, looking at 500 cycles from almost 400 mares, we compared the amnion product, no treatment, amnion and lavage, antibiotics and lavage, and antibiotics alone. And essentially, we found that the amnion was as effective at resulting in getting pregnancy as antibiotics, not maybe quite as good as adding lavage. And it seemed like that the two combination, amnion and lavage, maybe was a little bit higher. This was not a statistical difference. It was just numerical differences that we were seeing. And I'm just about out of time, but one of the things that I'm really passionate about is recognizing that nutrition is foundational for reproduction. Most of our horses are in good nutritional status. They get a good basic diet. They have access to forage. They're, in many cases, overweight rather than underweight. And so for most cases, small changes in nutrition probably are not going to make the difference because the mares already are getting the nutrition that they need. However, in mares that have metabolic disease or mares that are experiencing stress, there certainly are nutritional interventions that are worth doing. They don't happen immediately, but there are supplements that have been studied in other species that improve fertility. And in horses that have reasons for decreased fertility that are primarily associated with stress or with changes in diet, and then adding supplements may enhance their fertility. Mares that have underlying infertility, again, adding supplements may enhance their fertility. And there's a growing body of evidence from various laboratories looking at that. In our case, we found that we had a high quality diet for all of our mares. All of the mares got a supplement that was a high quality supplement, but adding a supplement that was specific for pregnancy decreased the number of cycles that the mares needed to be bred and increased the pregnancy rate on the first cycle and then subsequent cycles in maiden mares that were experiencing stress as they were coming off of the racetrack. So in conclusion, a successful breeding season is the result of a successful collaboration between the mare, the stallion owner, and the veterinary team. Underlying fertility of the mare and stallion should serve as a baseline for expectations and decisions. Good timing is by a long shot the most impactful aspect of breeding management, not any of the procedures that we talked about at the end. But there are targeted interventions that can optimize systemic and reproductive health and may further improve pregnancy outcomes. And so with that, I just want to come back to the symposium. We have the Symposium on Equine Reproduction, Saturday, February 28th. It's about half a day we'll start lecturing at 9, should be done about 12:30. You could register in person or virtually. I'll leave this link up. If you copy it down or just send us an email, we'll be happy to share the link with you. And we would be thrilled to see many of you either in person or virtually at the symposium in a week and a half. With that, thank you very much, and I'll be happy to answer as many questions as I can.
Thanks, Dr. Bailey. We have one question already in the Q&A from one of our participants. I'm going to sort of use this question so it can be a bit more broad for the crowd. The question is about maiden mare cervix, and if the same challenges can be expected after that mare subsequently foals.
Yeah, so maiden mares are a little bit of a unique challenge. And in the thoroughbred world, maiden mares are oftentimes young. And so the expectation is that they would be quite fertile. In contrast, if we're talking about performance horses, oftentimes we have maiden mares that are mid-age or starting to get a little bit older as they've completed a performance career. And so I interpret that the maiden mare cervix is a 15-year-old mare or a middle-aged to older mare that potentially is not softening her cervix at the time of breeding or before breeding, and consequently is pooling fluid. And my experience is that does not immediately go away after breeding. So a mare that has started to develop fibrosis, I'll say, in her cervix is more likely to do that on subsequent breedings as well. Now, there is some rehabilitatory effect, I would say, of the stretching that occurs during normal pregnancy and then subsequently. But a mare that didn't have a pregnancy until she was already a maiden mare and had trouble getting pregnant the first time likely is going to have trouble getting pregnant the second time as well.
Thank you. We have another question here about involvement of your veterinarian when choosing breedings, and your thoughts on that.
I think that veterinarians can provide a lot of good input on that, mostly by evaluating the fertility of the stallion and the fertility of the mare and making recommendations based on that. most veterinarians don't have the training or expertise in picking the genetic matches. And so I think there are some veterinarians, especially if they're veterinarians that are in your breed, they may have really good insight in that. But independent of the genetic match or the value of the resulting foal, if you involve your veterinarian in that decision, they will very likely be able to decrease the amount of time you spend trying to get the first foal.
Are there any other questions from our participants? Please feel free to put them in the Q&A. We have a little bit of time.
We had the one emailed question. Would you like me to address that?
Go for it. Yep.
All right. So we had one question that was emailed ahead of time. It was related to a mare that was used as an embryo recipient, and she got sick during pregnancy, and had developed a placentitis, and unfortunately didn't manage to produce a foal. Uh, didn't manage to produce a foal in that season, and then also had some postpartum problems. And so the question was, what could be done to prevent problems in the future? And that's a really unfortunate series of events. I would say that placentitis doesn't often recur, so there shouldn't be an assumption that because a mare had a placentitis one time, she is going to have a placentitis in future pregnancies. Those are things that happen sporadically, and although I think there are some underlying causes that increase a mare's risk for placentitis, if they're otherwise healthy, I wouldn't exclude a mare that had had a history of placentitis from the breeding pool. Similarly, a mare that had problems around the time of foaling, let's say a retained placenta or other things, she may have an initial change in her pregnancy rate. So in the first months post foaling, she might, but in the long term, as she goes through normal cycles of estrogen dominance and progesterone dominance, she should clear out any debris that's in her uterus associated with that. The one exception is that if she had a difficulty foaling and there was some sort of trauma to her uterus, and then that obviously would stay as scar tissue in the uterus, and that would cause a long-term risk for pregnancy. In the absence of dystocia, I would probably view this mare a year later or a breeding season later as a relatively normal mare of her age. I would absolutely recommend a breeding soundness exam, but I wouldn't exclude her from my potential breeding population because of her history.
We have a couple more questions here in the chat. The first one is about breeding on the first cycle and the transitional period during the spring, or whether it's better to breed on subsequent cycles.
Say that one more time, please.
The question is breeding on the first transitional cycle in the spring, or is it better to wait for subsequent cycles?
My personal opinion is that it's better to wait for subsequent cycles. And it's not because the first transitional cycle of the spring is necessarily infertile. It's because it's very hard to interpret and know whether the first transitional cycle or the first true cycle where they ovulate is going to be the first ovulatory cycle or the last transitional cycle where they grow a follicle and then it regresses. And so if everything is perfect and I am pretty confident that a mare is going to ovulate, and then I will try and breed them on that first cycle. But I think for the finances of managing a cycle and the potential lost or wasted semen if she doesn't ovulate, the potential contamination in the mare that maybe isn't going to ovulate. My recommendation is to wait until a CL has been diagnosed, a corpus luteum has been diagnosed, so that we know that she's ovulated once and then she should ovulate normally in the future.
Great. Dr. Bailey, can you talk about the supplement that you're discussing a little bit more at the end? We have a participant asking specifically about that.
Yeah, so uh, in the thoroughbred world, lots of supplements get used for a variety of reasons, and one of my goals while I was there was to really critically evaluate uh, each of the things that we were using, and we had enough horses that we could use groups of 50 or 100, where we could compare one treatment to another. And so there isn't a particular product that I would advocate that everyone should use to get improved pregnancies. But the product that I looked at and had success with was a product by Platinum Performance that was aimed at improving pregnancy rates. So it was Platinum Performance Reproductive Care. And in our hands, the mares that got that, their cohort would have gotten another Platinum Performance product, which is Platinum Performance GI. So those are both high quality, well-researched, widely used supplements. And I thought it was pretty telling that in our maiden mares, the mares that got the product for reproductive care had better pregnancy rates than the mares that were on Platinum Performance GI. That being said, I think there are a number of supplements out there. Some of them are very well researched, and some of them are less so. The difficulty with any portion of the supplement industry is that there's very little regulation. And so I would do my research as a potential buyer and really ask the people that are making the supplement what kind of quality control they have. Maybe ask to see their facility if you happen to live nearby, and then ask what the research basis for the supplement that they're advocating is. I think there are probably a number of them that are good, and I think there are probably a number of them that are either harmful or not better than nothing.
I think we have one last question here, and it's about when you should or should not rebreed a mare on foal heat.
Okay, that's a good question. And I skipped the breeding on full heat because it's pretty controversial. There are some people that feel like that mares should never be bred on full heat. I'm not one of those. But in general, mares take about 15 days to bring their uterus from a pregnant uterus back to a cycling uterus, which is amazingly fast. The uterus is the size of a large trash can at the time that the foal comes out, and 15 days later, it's microscopically normal. So that's an amazing amount of change over a very short period of time. But most mares will cycle on day 10 or earlier, so before their uterus is back to normal. And if they cycle earlier than day 10, there's pretty good evidence that the embryo would reach the uterus at a time that involution hasn't completed, and probably they will have a reduced pregnancy rate. And then secondarily, if there was any complication with the pregnancy, if the mare had a retained placenta, if she had a difficult birth, if she had fluid in her uterus at day 8, I would not breed that mare on full heat, and I would let her go through one normal estrus, meaning her full heat, and then either short cycle her and bring her back in shortly thereafter, or breed her on her 30-day heat.
Fantastic. I think there's one other question here in the chat about supplements and semen quality. I can put in the chat some of the ones you've recommended to us, but if you had another minute and wanted to talk about that, that would be great.
No, it's one of those areas that there are many supplements out there. And I think that especially for semen quality, the reasons for poor semen quality are so great, and the sensitivity of individual stallions is so great. It's really difficult to just make a blanket statement that I recommend one product or another.
Thank you again, Dr. Bailey, for your time. And just our last plug for the 28th. Please, if you're interested in equine reproduction and like to participate in person or virtually, we'd really like to see you there.
Thank you all.
Everyone.
Thank you for your time.